Hello friends, this is Dr. Krup Vasavda and our today's topic of discussion is Mental Health Act 1987, which is very important topic. Let us see introduction. This act was enacted for better treatment and care for mentally ill person. एक अच्छी ट्रीटमेंट और उसकी केयर के लिए ये जो मेंटल हेल्थ एक्ट है वो एनेक्ट किया गया है. द एक्ट मेड प्रोविजंस विथ रिस्पेक्ट टू मैनेजमेंट ऑफ प्रॉपर्टी एंड अफेयर्स ऑफ मेंटली इल पर्सन. ये जो एक्ट है वो मानसिक रूप से बीमार व्यक्तियों के मामलों और उसके संपत्ति के प्रबंधन के संबंध में प्रावधान किए गए हैं. द एक्ट ऑल्सो प्रोवाइड्स प्रोटेक्शन ऑफ ह्यूमन राइट्स और mentally ill person. This act contains 10 chapters and 98 sections. Let us see chapters. यहाँ पे जो 10 चैप्टर है उसके बारे में उसका इंफॉर्मेशन दिया गया है, जिसमें चैप्टर 1 deals with various definitions. Here the term mentally ill person is used instead of insane or lunatic. Similarly, instead of lunatic prisoner, the term mentally ill prisoner is used. And instead of mental hospital, the term psychiatric hospital or psychiatric nursing home is used. Chapter 2 provides procedure for establishing mental health authorities at center and state levels. Chapter 3 deals with the procedure for establishment and maintenance of psychiatric hospital or psychiatric nursing homes. Chapter 4 provides provisions for admission and detention of mentally ill person in psychiatric hospital or psychiatric nursing home. Chapter 5 deals with the inspection, discharge, leave of absence and removal of mentally ill person. Chapter 6 deals with judicial acquisition regarding alleged mentally ill person possessing property, custody of his person and management of his property. Chapter 7 deals with liability to meet cost of maintenance of mentally ill persons detained in psychiatric hospital or psychiatric nursing homes. Chapter 8 deals with protection of human rights of mentally ill person. Chapter 9 deals with punishments, ties and procedures. Chapter 10 deals with miscellaneous particulars. So these are the 10 chapters. Procedure of admission and detention. Procedure of admission and detention of mentally ill person in psychiatric hospital or psychiatric nursing home are prescribed in chapter 4 of MHA 1987. In that, first one is admission on voluntary basis. Second one is admission under special circumstances. Third one is admission under reception order. Fourth one is admission as inpatient after judicial inquiry. And fifth one is admission as a mentally ill prisoner. So these are the 5 admission procedure and detention or discharge of mentally ill person. In that, first one is voluntarily patient should be discharged within 24 hours of the receipt of request for discharge made by patient or if minor made by guardian. Second one, mentally ill person received in psychiatric hospital on application made by his relative or friends. In this condition, the friends or relative may apply to the magistrate for the discharge. Third one, the medical officer in charge of psychiatric hospital can order the discharge of any patient on recommendation of 2 medical practitioners, one of whom should be a psychiatrist. So जो medical officer है वो भी बोल दे सकता है, but उसमें से एक 2 मेडिकल प्रैक्टिशनर के रिकमेंडेशन से, बट उसमें से एक साइकेट्रिस्ट होना जरूरी है. फोर्थ वन, अ पर्सन डिटेन्ड ऑन रिसेप्शन ऑर्डर कैन बी डिस्चार्ज इफ जुडिशियल इंक्वायरी फाइंड्स हिम ऑफ साउंड माइंड. अगर ऐसा लगता है कि वो साउंड माइंडेड है, देन अ पर्सन कैन बी डिस्चार्ज. एनी रिलेटिव और फ्रेंड ऑफ मेंटली इल पर्सन, दिस इज वेरी इंपॉर्टेंट, कैन मेक एन एप्लीकेशन टू द मेडिकल ऑफिसर इन चार्ज of the psychiatric hospital for discharge. The medical officer in charge forwards this request application to the appropriate authority, can be magistrate, under whose order the mentally ill person was detained. Such authority can pass an order of discharge if the relatives or friend excuses a bond to take proper care of such mentally ill person. Thank you for watching this video. You can subscribe this channel, you can click bell icon, and you can share this video amongst your friends. Thank you.